Hey guys, it's Kelly again. I'm going to talk to you all about now how we manage opiate withdrawal and how the medications that we use and some of the symptoms that a person may have. We use a COWS scale to score withdrawal symptoms, and the COWS stands for Clinical Opiate Withdrawal Scale. It is used by healthcare providers, anybody dealing with patients who are detoxing from opiate drugs. It's an 11-item scale, and it assesses the severity using a subjective and objective method. Each item is scored from either 0 to 4 or 0 to 5 with a maximum score of 48. The higher the score, the more severe the withdrawal. Some of these assessment categories include your resting heart rate, sweating, restlessness, pupil size, bone and joint aches, muscle aches, runny nose, tearing up, GI upset like nausea, vomiting, diarrhea, tremors, yawning, anxiety and irritability, and goosebumps. So some of the mild symptoms, someone experiencing a mild opiate withdrawal may just have some anxiety, insomnia, yawning, runny nose, and sweating. More moderate symptoms are going to include those plus an increased heart rate, restlessness, dilated pupils, muscle and joint aches, and nausea and vomiting. More severe symptoms, obviously going to include all those from the mild and moderate, plus having a severe agitation, diarrhea, tremors, the goosebumps, high blood pressure, high heart rate, and hallucinations, as well as possibly seizures. There are some dangers associated with opiate withdrawal: dehydration from, vomiting and diarrhea, hallucinations, and seizures, of course, would require medical attention. And it's important to detox from opiates under medical supervision for these reasons. Scoring severity. So to be in that mild withdrawal category, you'll need to score anywhere between 5 and 12. Moderate is scored between 13 to 24. Moderately severe is 25 to 36, and severe is anything 37 or higher for a score. For opiate withdrawal, a COWS score can be used to initiate a taper of medications or in a sliding scale basis. And medications are also then used to treat the symptoms associated with the withdrawal. We would sometimes see clonidine used to help reduce the anxiety, the runny nose, the sweating, and the heart rate and blood pressure. NSAIDs like ibuprofen for the muscle aches and joint aches. We could also use Flexeril for severe muscle cramping. We're going to use antiemetics like Zofran, usually as a sublingual medication. If vomiting persists, we could move on towards injectable antiemetics. Loperamide is given for diarrhea. And we usually can give some Zyrtec for the runny nose as well if the clonidine isn't available or not working for them. There's also then they can move on to their taper off the opioids using medications that can also then be transitioned to long-term medication-assisted treatment and therapy. Buprenorphine naloxone, also known as Suboxone, which is what my facility uses for their tapers. It helps reduce the cravings and prevents relapse. Methadone is a very commonly used medication for long-term therapy as well as for a taper to reduce the cravings and withdrawal symptoms. And then naltrexone is a third medication that is opioid antagonist, and it blocks the effects of all opioids, and it helps prevent relapse. Opiate detox, it's not a fun thing for people to go through. I've seen patients suffer. So don't abuse opioids is the real lesson in what I've seen. And seek medical treatment if you know somebody or are someone who needs to detox from opioids and get on a path for sobriety. And if you have any other questions or comments, drop them below. Thanks. Bye.